Hey there! If you're a nursing student getting ready for an exam or heading into your next clinical, you're in the right place. Today, we are going to break down one of the most crucial skills you'll ever learn in your entire career, mastering infection control.
So here's our game plan. We're going to start with the invisible enemy. These are healthcare-associated infections. And then we'll walk through exactly how we fight back, from proven protocols and protective gear to handling hazards in the workplace.
All right, let's jump right into Section 1. We have to start by defining the threat, the biggest challenge you're going to face every single day: healthcare-associated infections, or HAIs.
So what are they? Well, to put it simply, these are infections a patient gets while they're getting medical care. Infections they didn't have when they first walked in, and they are a huge risk to patient safety. A big reason for this is that things like IV lines and catheters literally create a superhighway for dangerous germs to get right into the body.
You're going to hear these four names a lot. These are the big four HEPIs you'll be working to prevent on every shift: CLABSIs, CAUTIs, SSIs, and VAPs. They're so common and so dangerous that pretty much all our infection control strategies are built around stopping them.
Okay, so we know the enemy. How do we actually fight back? Well, that brings us to our first line of defense: infection control bundles. This is where we get proactive.
The best way to think of these is like a simple life-saving checklist. These aren't just good ideas or suggestions. They are proven, evidence-based steps that, when you follow them every single time, they dramatically cut down infection rates and, yes, they save lives.
And this is a perfect example of how it works. This is the CLABSI insertion bundle. Just look at it. Every single step, from basic hand hygiene to using maximal sterile barriers, is all designed to stop a bloodstream infection before it even has a chance to get started.
But, and this is so important, prevention doesn't stop once the line is in. Consistent, careful maintenance is what keeps that patient safe day after day. Daily baths, scrubbing the hub every single time you use it, and this is a big one: getting that line out the second it's no longer needed. Those are the actions that truly make the difference.
Okay, let's level up. It's time to talk about an even bigger threat, one that requires a whole other level of caution: multi-drug-resistant organisms, or MDROs. So what's the big deal with these? Well, this slide lays it out perfectly. A standard infection, we can usually knock that out with a common antibiotic. But MDROs, what we call superbugs, have actually evolved to fight off our best drugs, which makes them incredibly tough and sometimes almost impossible to treat.
You need to know these names: MRSA, VRE. You're going to see these on patient charts for your entire career, so burn them into your brain. Recognizing these names is the critical first step to using the right precautions and stopping their spread.
So let's look at a quick, real-world scenario. You have a patient who's kind of confused about their diagnosis. This isn't just a simple conversation. This is a crucial teaching moment for you, the nurse, to explain what's going on and why everyone has to take special precautions.
Okay, pop quiz time. Thinking about that patient. They have MRSA. What PPE are you grabbing before you walk into that room? Well, the answer is you're going to need contact precautions. And that means, at the absolute minimum, a gown and gloves every single time.
And that leads us perfectly into our next critical skill: how to correctly use your personal protective equipment, your PPE. This isn't just a uniform, you guys. This is your armor.
So here's your toolkit. You know the drill: gloves, gowns, masks, eye protection. These are the essentials. Knowing what to wear, and more importantly, when to wear it, is a totally non-negotiable part of your job.
Now listen up, because this is where people mess up all the time. Putting PPE on is one thing, but taking it off correctly is even more important. One wrong move and you can contaminate your own skin or your clothes, which defeats the whole purpose. This sequence, gloves, then goggles, then gown, then mask, followed immediately by hand hygiene, it's designed to protect you after you've protected your patient.
All right, we're in the home stretch now. For our final section, let's talk about handling other hazards, because real infection control goes way beyond just patient contact.
Let's be real for a second. This is one of the most serious and constant risks you will face in your career. Preventing a needle stick injury is not about being lucky. It's about being vigilant and following protocol every single time you handle a sharp. There are no shortcuts, period.
These right here are your rules to live by. Engage the safety, dispose of it right away, never ever overfill a sharps box, and if an accident does happen, you report it immediately. These simple steps can literally protect you from life-changing infections like hepatitis B and HIV.
You know, this quote really hits the nail on the head. Mastering infection control isn't just about learning a technical skill. It's a core piece of your professional identity. You are the advocate and the protector for your patient, and that all starts with protecting yourself and your environment first.
So I'm going to leave you with this challenge. Don't just watch this and forget about it. Apply it. Think about just one thing we talked about. Maybe it's scrubbing the hub or the order for taking off PPE, and decide right now how you're going to consciously focus on that in your very next clinical or lab simulation. Turn it into a habit.
Hey, if this explainer helped clear things up for you, do me a favor and hit that like button and maybe share it with your study group. And definitely subscribe for more nursing explainers just like this one to help you crush your courses. And before you go, check out the links in the description below. We've got some of our favorite NCLIX review books down there. Thanks for watching.